The topic of this video will be the scapula. I have two real scapulae. This is the left and this is the right. And I also have a plastic one. So I'll be showing you features on all three. Let's first talk about how you can tell left from right scapulae. Well, this is a posterior view of the scapula. And on the posterior surface, there is a very visible feature, which is the spine of the scapula. So you know that you're looking at the posterior surface when you see the spine of the scapula. The anterior surface of the scapula is smooth here. So you know that's the anterior or costal surface. So you got the scapula oriented so you see the posterior surface. And then the other thing you're looking for is the glenoid fossa, or the glenoid cavity, where the head of the humerus articulates for the shoulder joint, or glenohumeral joint. We know that that's lateral. So if this is posterior and this is lateral, then we know we've got a left scapula. This is also a left scapula. So we see the spine of the scapula on the posterior surface, and then laterally the glenoid fossa. This is a right scapula. So you see the spine of the scapula and the acromion. And then there's the glenoid fossa, which faces laterally, so we know this is a right scapula. So the scapula is part of the appendicular skeleton, the upper extremity or upper limb appendicular skeleton. And it's considered a flat bone, and it's part of the shoulder girdle. The other bone that's part of the shoulder girdle or the pectoral girdle is the clavicle. It's also interesting to note that the processes, it has several processes, the processes and the thicker parts of the scapula are made of trabecular bone, but the thinner parts of the body are just thin cortical bone. And you can really appreciate that in these real scapulae, how thin the body is. And you can even see that some of it was so thin that some of it broke. And here it's almost transparent. And in this one, same thing. You can see how transparent it is. And sometimes, these are fractures or just things that have been broken off the body just from handling. But sometimes the body can be incomplete and there can be openings. And usually those openings are filled with fibrous tissue. I don't have an example of that. So let's look at the surfaces of the scapula. So this is a posterior view. So this is the posterior surface. This is the anterior surface, or also called the costal surface, because this is the side that's in contact with the ribs. Now let's look at the borders. So this is the medial border, or the vertebral border. This is the lateral border, or the axillary border. And then this is the superior border. Whoops. This is the superior border. Then the scapula has angles. This is the superior angle. And now I'm going to start talking about muscles related to the scapula, because you never want to learn osteology in isolation. You always want to learn osteology as it pertains to the soft tissues that are attached or run through or next to the bones. So this superior angle is where the levator scapulae attaches. So think of the levator scapulae associated with the superior angle of the scapula. If we travel down the medial border or vertebral border, we know the rhomboids are attached to the medial border or vertebral border. The rhomboid minor here, where the root of the spine of the scapula or base of the spine of the scapula is located. So that's where the rhomboid minor attaches. And then inferior to that along the medial border is where the rhomboid major attaches. The rhomboideus major, or rhomboid major, attaches here. This is the inferior angle, and the inferior angle, sometimes a little slip of the latissimus dorsi attaches at the inferior angle. And then if we go up the lateral border or the axillary border, the teres major attaches here. Teres major attaches here. You can see this area here where it attaches. Let's grab the real scapula. So here's the inferior angle, medial border, lateral border, and do you see this ridge right here? So the teres major attaches to the lateral border of the scapula on this area here. If we continue up the lateral border, then the teres minor is attached here, more superiorly. And then if we follow the lateral border up to the glenoid fossa, inferior to the glenoid fossa, there's a roughened area. That's called the infraglenoid tubercle. Infraglenoid tubercle, and that's where the long head of the triceps brachii attaches. So just to review, here's the inferior angle. Latissimus dorsi sends a little slip to attach sometimes to the inferior angle. If you look for this oblique ridge inferior to that on the lateral border is where the teres major attaches. Then the teres minor attaches here. Then the infraglenoid tubercle is the long head of the triceps brachii. So superior angle, levator scapulae. Here's the inferior angle. Okay, let's look at the fossa or fossae that are on this posterior surface. Superior to the spine of the scapula, here's the spine of the scapula. Superior to the spine is the supraspinous fossa, and that's where the supraspinatus attaches. Inferior to the spine of the scapula, here, is the infraspinous fossa, and that's where the infraspinatus attaches. If we turn the scapula over to the anterior view, this is the subscapularis fossa, and the subscapularis attaches there. Okay, let's talk about the spine of the scapula a little bit more. Notice from this view how the spine of the scapula emerges from the body of the scapula. Do you see this? All of that. And the spine of the scapula, you can say it starts on the medial border here. I've always called this the root of the spine or the base of the spine of the scapula. And then notice that the spine of the scapula has a superior lip and an inferior lip. Those are for muscle attachment. So attaching to the superior lip is the trapezius, and attaching to the inferior lip is the deltoid. The spine of the scapula is continuous with the acromion or acromion process. This edge right here, or angle here, is called the acromial angle. And then we can see the lateral edge of the acromion process here. Then the anterior edge of the acromion process here. And then we look medially, we can see a small facet for the clavicle. And so that's where the clavicle articulates with the acromion of the scapula to make the acromioclavicular joint. So there's a small facet here on the medial aspect of the acromion for the clavicle to articulate. The attachment of the deltoid continues from the inferior lip of the spine of the scapula around to the acromion process here. And there are ligaments also attached to the acromion process we'll talk about in a moment. Let's take a look at some notches. Now, this notch is a little bit different, so we're going to look at the plastic scapula. At the superior border, near the base of the coracoid process, there is a notch. I've seen this called by a couple of names: scapular notch, suprascapular notch. And that notch is closed off by a ligament that goes from one edge to the other edge. And that ligament is called the superior transverse scapular ligament, superior transverse scapular ligament, or it's called the suprascapular ligament. Now, sometimes that ligament ossifies, and these two real specimens show the ossification of that ligament. So it turns the notch into a real bony foramen. This other one is also ossified. So you can see the suprascapular notch, which was a bony notch, was turned into a bony foramen. That ligament in the cadaver is as hard as bone. So if you're dissecting and you press down in the area of the notch, you'll feel that very strong, rigid ligament, the suprascapular ligament or the superior transverse scapular ligament. So that ligament turns the notch into a foramen, and what passes through that foramen is the suprascapular nerve. So the suprascapular nerve from the brachial plexus is approaching the notch this way, passes inferior to that ligament, innervates the supraspinatus in the supraspinous fossa, then passes through another notch. This is the spinoglenoid notch. You can see it from this angle, spinoglenoid notch. And then it innervates the infraspinatus in the infraspinous fossa. Passing superior to the ligament is the suprascapular artery and suprascapular vein. So the typical mnemonic that's used, or memory trick to remember that relationship, is that if you think about the nerve, N for navy, the navy goes under the bridge, so the ligament is the bridge. The navy goes under the bridge in their boats. And then the Army or the Air Force, A for artery, A for Air Force, or A for Army, goes over the bridge or superior to the bridge. So that's a fun memory trick to help you remember the relationships. So if we look at that spinoglenoid notch here, it's the notch between the glenoid fossa and the spine of the scapula. Spinoglenoid notch. This has an occasional or variable ligament that closes it, and this ligament is more membranous, less fibrous. So it's weaker, and it's variable, and it's called the spinoglenoid ligament or the inferior transverse scapular ligament. And it closes this notch to create a foramen through which the suprascapular artery, nerve, and vein all pass to travel from the supraspinous fossa to the infraspinous fossa. Both of those notches are potential sites of compression or impingement, so keep those in mind. Okay, now let's look at the glenoid fossa. So the glenoid fossa is oval or pear-shaped. It's narrower superiorly than it is inferiorly. So it's wider inferiorly than it is superiorly. And it's typically covered with articular cartilage, which is not shown on this bony specimen. And it's for the site of articulation with the head of the humerus. Inferior to the glenoid, I mentioned earlier, is the infraglenoid tubercle for attachment of the long head of the triceps brachii. Superior to it is the supraglenoid tubercle, a roughened area here, for attachment of the long head of the biceps brachii. Also attaching to the glenoid on its rim is the glenoid labrum. So attaching to the rim, not shown on this bony specimen, but is the fibrocartilage glenoid labrum. Let's look at the glenoid of the real scapula. So here's the oval-shaped or pear-shaped glenoid fossa or glenoid cavity. Supraglenoid tubercle. Notice its relationship to the coracoid process. And then infraglenoid tubercle. And those are just really roughened areas for muscle attachment. It's more of a roughened area. From this view, we can see the acromion, the lateral edge of the acromion, and the tip of the acromion, or the anterior edge. And by the way, in Greek, acro, acro, means extremity or tip, and omos means shoulder, O-M-O-S. Omo means shoulder, or omos means shoulder. So acromion process is the tip of the shoulder, the tip of the shoulder. Okay, let's look at the coracoid process. Coracoid process, it means crow's beak or bird's beak. And notice how it projects anteriorly and laterally. It's the site of muscle attachment and ligament attachment. The muscles that attach to the coracoid process are the pectoralis minor, the short head of the biceps brachii, and, of course, the coracobrachialis. The ligaments attached to the coracoid process are the conoid and the trapezoid, and those are the two parts of the coracoclavicular ligaments. So it's pectoralis minor, short head of the biceps brachii, and coracobrachialis for the muscle attachments, and then for the ligament attachments, conoid and trapezoid. Also, coracoacromial ligament going from the coracoid process to the acromion, making the coracoacromial arch. And then there's a coracohumeral ligament that goes from the coracoid process to the head of the humerus. Another small muscle that I should mention is the Omo Hyoid. Remember, Omo means shoulder in Greek, and hyoid is the muscle in your the bone in your anterior neck, and it's attached to the superior border of the scapula. So I'm going to get the artificial scapula here. Here's the superior border. Here's the suprascapular notch. There's the coracoid process. So the Omo Hyoid attaches here, medial to the suprascapular notch on the superior border of the scapula. And then the other end of it attaches to the hyoid bone. So I'm going to pause for a minute and think about what do we still need to talk about. If you think about the position of the scapula on the thorax, we know that the scapula is not in the frontal plane. It's at an angle about 30 degrees to the frontal plane, and that puts the coracoid process almost pointing directly anteriorly. And the coracoid is covered by the anterior deltoid, but if you palpate the deltopectoral groove, which is the groove between the deltoid and the pectoralis major, that's a good place to start for palpating the coracoid process. The other thing to consider is what ribs and what vertebrae it's associated with. So if we look at it from a posterior view, so it would be angled away from us like this, that the root of the spine or the base of the spine of the scapula is about level with the T3 vertebra, superior angle about T2, and then the inferior angle about T7. That's a normal upright resting posture of the scapula. So the scapula covers ribs 2 through 7. I think we need to talk about the serratus anterior's attachment. So the serratus anterior is attached to the scapula and then to ribs 1 through 8. And we're looking at the anterior or costal surface of the scapula. And the serratus anterior is attached from the superior angle of the scapula along the medial border or vertebral border all the way down to the inferior angle. I'm going to pick up one of the real scapulae. So here, near the superior angle or at the superior angle on the ventral surface, there's a roughened area, and that's for the first slip or first digitation of the serratus anterior to attach. And then it attaches along this medial border on the anterior surface. And then again, there's a roughened area here on the inferior angle for the lower slips of the serratus anterior to attach. So I've seen references that say the lower 5 slips. So if the first slip is here, and then the lower 5 are here, which would be like 4 through 8, that means the other 2, 3, and 4 slips are attached along here. That all those numbers may not work out correctly, but just, I think, keep in mind that there's a very big slip that attaches at the superior angle and quite a few slips that attach near the inferior angle. If you consider the glenoid fossa like the head of the scapula, then this area that's narrow would be the neck. The scapula is just covered with muscles, and so it's rarely fractured. And I know it's kind of funny because I'm holding a scapula with a hole in it, but it's covered by and surrounded by thick muscle, so it's rarely fractured. I think I've covered everything. Hopefully I haven't left anything out. If you notice these tiny foramina here and here, those are nutrient foramen or foramina for blood supply, and the scapula is supplied by a anastomosis of multiple arteries. So suprascapular artery, circumflex scapular artery, and then the transverse cervical artery. So providing a anastomosis of vasculature to provide blood supply to the scapula. All right, I hope that was helpful.